to introduce the theme. The Health Ministry, the government, the General Director for Health, the General DGOs, the General Director for Social Action, National Health, the Regional Health Agencies, National Agency for Assessment of the National Agency for Safety of Medications, the Agency for Biomedicine, the French Blood Center, the High Council for Future, to list but a few. In these healthcare and systems institutions, people work in offices, most often in Paris, drawing up endless bylaws, decrees, directives, regulatory texts, quality reference systems, and recommendation for hospitals and doctors' surgeries. The life of a hospital doctor or GP in their surgery would be too simple if this crazy tower of texts, which are sometimes contradictory, did not require all the crazy checking and monitoring to go with them. This regulatory craze is full of good intention, whose aim is to help healthcare structures to run in the best possible way. But the result is quite the opposite. In this bureaucratic and bureaucratical system, each pawn ends up ensconced in a straitjacket without anybody really being responsible for the objectives or results. What's the solution? Perhaps it will come from companies who have long understood that the only means of improving the quality of services procured is to switch from a vertical organization to a horizontal and cross-functional model based on projects. All managers know this. Innovation comes from the field. An orderly nurse will also know how to optimize their practices better than somebody working in ministry. Patients have thousands of suggestions about how their demands can be better met, and most of these don't cost a penny more. There's a wealth of ideas out there. We simply need to harness them. When are we going to get hospital directors to do an immersion course in their own hospitals by burying stretchers, washing patients, or instruments?